Welcome to Chautauqua People. My guest today is Bob Scott, recently retired from a 44-year dermatology practice in Jamestown. He is a New York State native who graduated from Ohio State and Cornell University Medical College. He completed his residency in dermatology at the University of Pennsylvania and is board certified. Dr. Scott is past president of the Jamestown Medical Society, Chautauqua County Medical Society, and Chief of Staff of WCA Hospital. He's a former trustee and mayor of the Village of Lakewood, past president of the Chautauqua Lake Association. Despite all of this community work, he's still married with 3 daughters and 8 grandchildren. Several college summers were spent at Chautauqua Institution. Bob, what brought you to Chautauqua? And what did you do during the summers?
We enjoy coming here as a family, and we started in the 80s, and it was a chance for my children to meet people outside of our community, and it was a chance for me to get involved in things at Chautauqua. One of the nice things was that I was able to work every day, and my family was able to enjoy a 9-week vacation.
Right. Now, I understand you were working the waterfront as a college student?
That's correct.
And what did you do?
I was a lifeguard for 2 years during my first couple years in college, and then for the 3rd year I was the director of the beaches.
So you came back and gave your family swimming lessons, the kids?
Yes, I did.
And they had it down. Now, I understand that your residency was interrupted by military service during the Vietnam War era. Can you tell me about that?
Well, during my first year of residency, it became obvious that I was going to be drafted, and to avoid the draft and to go in as a physician and as a partially trained dermatologist, I joined the Berry program, which allowed me to go in for 2 years in the Navy. We didn't have our choice of which service to go into, but I was assigned the Navy.
Mm-hmm.
And for 2 years I was practicing dermatology, even though I was partially trained. And it was during that time that I met my wife, who was a nurse in the Navy.
Right. And where were you assigned?
Initially I was down at Little Creek, Virginia, which is the amphibious base, and I was only there for a few months, and then I was transferred down to Pensacola, Florida, which is the air wing of the Navy.
Right. Now, did you treat many Vietnam-era injuries or medical problems from the war?
I treated some of the, not only Navy, but also Army and Air Force and Marines who came to our hospital during that time.
Mm-hmm. What were the common problems?
A lot of them were skin infections, and of course we had this problem called trench foot for particularly amongst the Marines and sometimes the Navy guys who were assigned to riverboats, mm-hmm. where their feet and legs became very macerated and infected due to the fact that they didn't take off their boots.
Couldn't get their cells dried out.
Right.
And properly cleaned. And so they gave them good treatment. Now, let's talk about the nature of your practice in Jamestown. What were the most common problems that you saw here in Chautauqua County?
I was a general dermatologist, and I took care of kids, adults. I'd say the most common problems were things such as warts, eczema, various keratoses that people had.
When you say keratosis, does that mean the cancer?
Well, there are 2 types. There's an actinic keratosis that's pre-malignant, and then also the subarrheic keratosis. There are these brown scaly things that are not pre-malignant, and we would treat those also. Mm-hmm. I also took care of people in nursing homes. I was the only specialist who went to nursing homes, and I also treated people in hospitals.
Right. And let's just talk for a moment. What's happening to the rate of skin cancer?
The rate of skin cancer is going up, And we don't know exactly why, and it might be just due to more cases being diagnosed. And maybe there are no more cases, but we're diagnosing them earlier and catching them early, and it's particularly true with melanoma.
Right. And are most primary care doctors able to identify these problems?
Yes, I think they do a very good job of that. And if they can't, sometimes the primary cares will biopsy them. In most cases, they don't. They just refer them to me or to a surgeon.
Mm-hmm. And what sort of regular surveillance would you recommend for your patients?
Well, I think the surveillance depends on what their skin type is. People who are blonde and red hair have an increased incidence of skin cancer, whether it be melanoma or whether it be a basal cell or squamous cell carcinoma. People who've had a blistering sunburn have a double incidence of getting melanoma later. Just one blistering sunburn.
Really?
And of course, people who've had a lot of sunburns that maybe weren't blistering also have an increased incidence of basal cell, squamous cell, and melanomas.
Right. So we're going to take a look in a moment at some pictures of melanoma here, and I wonder if you could tell us when this panel comes up momentarily what we need to be looking at, and if you were talking this through to a patient in good detail. Now we're pausing for just a moment, and we recognize that we don't have the highest resolution from Access Channel 5 given the situation with the cable companies, but this gets us a good start, and we'll follow up. So tell us what you would share with a patient.
The picture we see is a mnemonic helping people figure out whether a lesion they have is benign or malignant. And it starts out with a mnemonic of the first 5 letters of the alphabet. The A stands for asymmetry, where the left is not the mirror image of the right and the top is not the mirror image of the bottom. B is border, an irregular border. So instead of being nice and round or oval shaped, there are irregularities in the border. C is color, more than one color, a red and a black, a red and a brown, 2 shades of brown. Raises the suspicion of a malignancy. The D is a diameter, something that's greater than 6 millimeters or 1/4 of an inch. And finally, E is evolving moles that are changing. And we can see on this picture how the normal ones compared to the abnormal pictures.
And that lays it out. So let's take a look, if we can. We have a close-up here of a melanoma.
This is a melanoma, and we can't tell the size by the picture, but it's larger than 6 millimeters or 1/4 of an inch. It's asymmetrical. The left is not a mirror image of the right, and the top is not a mirror image of the bottom. The borders are definitely irregular. We have more than one color. And the E is evolving. We don't know about that because this is just a standard picture here.
Right, right. Now, these pictures are not as clear as we would like when they get delivered throughout the county due to the limitations of the system. And if we had a person who is a good scholar and wanted to take good care of themselves, where can they go to see more pictures with better detail?
Our Academy of Dermatology has a nice website, and it's aad.org. And on that website, not only does it talk about various skin problems, but also go over things to look for in melanomas.
Right. So let's leave that up for just a moment, but I would urge everybody to go and check it. And if viewers sense a certain element of urgency in my voice, we had a family member who passed away from melanoma in the past decade, and it's a death that should not have occurred. And I'm certain had he followed your advice, things may have been different. So let's take a look. Now, if a viewer then believes that a dermatology consult is required, and is, I guess, indicated in the academic term, what would you recommend for that person? And you're now retired, so nobody would have the idea that you're soliciting patients. You're just giving us good advice. What would you recommend?
I think that if somebody has a suspicion of a irregular mole or a irregular lesion, that they should see a dermatologist for diagnosis.
Right.
And most dermatologists take patients by, when they call up, they don't need to be referred by other doctors. So it's pretty easy to get in to see a dermatologist.
Now, where would you find a dermatologist? Western New York.
Well, unfortunately, we don't have any left in Jamestown anymore. We had 3 at one time, and after I retired, nobody wanted to come and take my place. But we have dermatologists in Erie and Buffalo are the nearest places to go. They're all board certified, and I would recommend any of the ones that are listed on the Academy of Dermatology list. People should also check, though, with their insurance companies before they go to make sure that the doctor is in their plan. Otherwise, it could be pretty expensive to see somebody if your insurance is not going to cover it.
Right. So if you would, let's say, go through that website as we recommended, American Academy of Dermatology, you see something that says, I need to go. Would that website steer you toward a member of the Academy who is a local, perhaps? You enter your zip code? Or, I'm asking a question you're probably not.
It's a really nice website. You can go in there and put your zip code, and it will list the board-certified dermatologists. Not only that, but how many miles they are from where you live.
Wonderful.
So
wonderful.
It's a nice site to go to.
So somebody can just go right at it, take charge, and then if it fits with their insurance plan, they're cooking, aren't they?
Yep.
And they're doing it. Okay. Now, what's the best way to ensure that treatment will be covered by insurance?
The best thing to do is to make sure, first of all, that the doctor is in your plan. Then, when you see the doctor, and if he wants to do any procedures, you ought to ask them whether it's likely that their insurance will cover that procedure.
Got it. Got it.
Medicare is pretty good at covering most things. Some of the individual plans are a little difficult, and they tend to call procedures on benign lesions as being cosmetic. And it really depends on how your dermatologist codes the diagnosis as to whether they're going to be paid.
Mm-hmm. Now, so we have a patient who's followed your advice, been to the website, had a good arrangement with the dermatologist, things are taken care of. Now it's a matter of some preventative advice. What advice do you give your patients?
I think the best advice we give now is to make sure people avoid unnecessary sun exposure. In other words, don't go out and sunbathe. If you want to go out to be in a sport, garden, that's fine. And if that is the case, make sure to use a sunscreen. I recommend a sunscreen with an SPF, a sun protective factor of 50 or above, and one that covers long ultraviolet light.
Okay.
That's the UVA.
Okay.
We suggest using the sunscreen on all exposed areas, and if you're going to be out all day long, to reapply it at noontime. Hats are also important because the sunscreens are not 100% effective, and they do wear off. Mm-hmm. So wearing clothes that can also block the sun is a good idea. Unfortunately, when the sun's out, it's warm, and it's sometimes uncomfortable to use clothes that cover up completely the sun.
Okay, so that's it. You just be smart about it. And I assume the hat should be one with a wide brim, cover your ears.
Yes.
And the like. Okay, I bought one of those, and before I walked the Camino in Spain this past year, it's the first time I've had a wide brimmed hat. I said, never had read that's the thing to do, and I'm glad I did. And I'm certain if I wear it on Chautauqua, people are going to tease me about it. But nonetheless, we're coming through this in good shape. Now, let's talk for just a moment here about people seeking regular preventative care. And are they always the people who need to be seen by a physician?
I don't understand your question.
For example, somebody comes in and wants to have an annual physical skin check. Typically, do you find those are the people who need to be in every year, or is there a cohort that doesn't seem to get themselves taken care of?
I think if you've had skin problems before, and particularly if you've had skin cancer, it's important to be examined once a year.
Okay.
If you've had melanoma, your best bet is to be examined every 3 months for the first couple of years, and then every 6 months afterwards, and then work yourself out to once a year. Unfortunately, we're probably seeing the wrong people in these skin screening clinics, which I mentioned to you.
Mm-hmm.
And the people who tend to come to those are people who in my estimation, don't seem to have many skin problems. So it's tough sometimes getting the people in who have a problem, and some of these people need to be picked out by their friends or picked out by their wives. Most of the men who come in are dragged in by their wives and want to have something checked out, and we frequently find things on them.
So
the women are checking themselves out pretty carefully. They know how to use mirrors, and they can use 2 mirrors and check themselves out, and they'll even ask their friends about things or even their husbands. But it's the men who tend to let things go, and by the time we see them, things are sometimes pretty advanced.
right, and so that's good advice then, to have somebody check you, isn't it? And follow that advice. Now, let's just have another approach here. Something we talked about earlier. You had significant appointment at WCA Hospital as the chief of staff, and now they have changed their arrangement. Can you talk about what's happened there and what the consequences are?
UPMC out of Pittsburgh has taken over ownership of WCA.
Right.
They call it like a strategic liaison, but they're basically running the show now, and I think they're planning on putting in something like $25 million to improve the hospital and also pick up some of the debt they have.
Mm-hmm.
And this should provide some good things for WCA and for the community.
And do you anticipate them having additional specialist physician care here as a result of that arrangement?
Apparently, they're going to try and fill positions that aren't being filled. They're going to try and bring in specialists that were lacking, and provide easy transition either to Hammett, which is their closest hospital, or down to Pittsburgh for care that can't be provided here at WCA.
That makes sense. Now, what's the status of small hospitals today? Is it easy for them to survive?
I think small hospitals are in terrible financial trouble. They're having trouble getting proper reimbursement for the people they're seeing. And a lot of people are bypassing the small hospitals and going to the larger hospitals for care. And it's tough for staffing. When you've got a floor that's half full, you really can't get rid of half your nurses. You end up having a lot of people there who are not being fully utilized.
Mm-hmm. And so they have this enormous expense, and then they don't have the revenue coming in to take care of it. Let's talk about something a bit more positive. Now, you've had substantial experience on Lake Chautauqua, and for the many years I've known you, you've had a boat on the lake and have residence on the lake. And then you spent time on the lake as a college student with the swimming in the lake. Can you tell me about your assessment of the status of the lake today, and also about the lake-related organizations? I think we mentioned 2 or 3 of them, and what they're doing in 2 hours or less. I've always lived on the lake since we moved here to Lakewood,
and I have had a boat on the lake. The quality of the lake has improved since I first came here. We had a terrible problem of aquatic weeds at that time, and the Lake Association, through harvesting of weeds mechanically and also by using herbicides, decreased that and made boating and swimming a lot more enjoyable.
Mm-hmm.
The Lake Association stopped using herbicides maybe 15 years ago and has just been doing harvesting. The algae blooms seem to be getting worse. I don't remember them being as bad many years ago when I came.
Mm-hmm.
And while the health department puts a ban on swimming when the algae blooms are out there, I never saw any skin problems from the algae.
Really?
Most people, though, don't want to swim in it. It's not very pleasant to look at that and to swim in it.
Mm-hmm. I remember wading through it not in Lake Chautauqua, but in my time in Special Forces, and no getting around it, and we're in a place where we have to be in the water, and it's just move along, I think.
The Lake Association has, not only do they do harvesting of weeds, but they have a shoreline pickup. And these guys will get on the shoreline and pick up all these weeds by pitchfork and then get rid of them. And they're in that algae all day long.
Got it.
And I never saw any problems with them.
Really? Really? That's a significant item. Now, how does the Lake Association differ from the watershed organization?
The Watershed Conservancy has to do with the area that drains into the lake. So it isn't just the lake, but it's all the land that drains down and the tributaries that drain down.
Mm-hmm.
And they do a good job of trying to stabilize some of the streams which are bringing in pollutants, and they're trying to stabilize the streams to prevent soil from being eroded. So they do a good job on that.
Okay. And are they in the business of acquiring property, or?
Yes, they are.
Okay. And that's very expensive, is it not?
It is, but most of that property is being donated to them by people in the county.
That's wonderful. That's wonderful. And so we have reason, presumably we have reason to be hopeful about the status of the lake. Now, do you have any status or take on the test that was done at Bemis a few weeks ago with some herbicides put in there?
Just what I read in the paper, and that is they used two herbicides that we had used, that CLA had used in the past, 2,4-D and Endothol. And we did not have any trouble with it back in those years. And I didn't hear of any problems with the application that was done, a month ago.
Right.
Some of the problems with these herbicides are picked off of the label, and the label may talk about injuries to fish and human beings, but it's frequently at a much higher concentration that's being used in the lake.
Mm-hmm.
And
And it's a point in which honest people can disagree, is it not, about the wisdom of using some of that chemistry. I've heard people who seem to be immensely sincere and informed, on both sides having very strong opinions about it. And my chemistry is not good enough to be informed, so I just sort of say that's a point if people disagree. Now, we have one two-part question here, and this is one that you're not anticipating, methinks, but it's an appropriate one and a great way to end. How many years have you been married?
let's see, I was married in 73,
44.
44.
What's your secret to a long marriage? In 3 minutes, or we've got 3 minutes here.
I think having children tends to pull us together and cut out a lot of the small differences you have so you can get together and take care of them. I think respecting the other person for what they are and putting up with shortcomings in yourself and your spouse.
Okay.
I've been very lucky to have been married this long.
Right. Now, as I mentioned the children, 2 members of our household are patients of one of your daughters. And what does she do?
My middle daughter is a veterinarian, and she wanted to be a vet from when she was 10 years old. That's all she ever wanted to do.
Okay.
And I told her, I said, Jill, it's harder to get in vet school than it is medical school. We've got to have a second thing to think about, and she wouldn't think of anything else. That's all she wanted to do.
And she's a terrific vet. And every time I tell the dogs they're going to see Aunt Jill, they jump up and down, they get very excited, and I've had a very good experience, although not a very frequent one, so we're happy to do it. Is there anything else we need to cover? Dermatology and the lake, and your experience here in this area.
I'd like to maybe talk a little bit more about Chautauqua.
Please do.
We are very fortunate to have a home there. I think we've been here as long as your brother, and I don't even know how many years that is. I think he came in the 80s at some point.
Mm-hmm.
And we have just developed so many good friends here. My kids, of course, went to the club and developed a long-lasting friendship down there of various people. The programs are fantastic. Even if I don't like the subject, the speakers are just great speakers, and I'm very fortunate to. This is the first year I've ever heard a speaker. I've worked every single day during the weekday
Really?
when I was in practice, so this is the first time I've experienced going to lectures.
My goodness. And you're close, so you don't have to go very far. Your front porch to hear some of it.
I like to go over for the church service and for the 10:45 lecture. If I don't, I get distracted.
Right, right. And so that's worked out very well. I guess just one last thing, and that is a word of thanks for your practice. And when you and I were able to work out an arrangement for you to come here, and I talked to the crew, indeed, there are patients, former patients, who are here on the crew and all say good things. So thank you very much for 44 years for Chautauqua County residents.
And thank you, John, for having these talks, and I enjoyed your friendship over the years.
Great, great. It's great fun, and do come back.
Thank you.
This has been Chautauqua People. My guest has been Dr. Bob Scott, who's just retired after 44 years as a dermatologist in Jamestown.